Good morning, Europe. Good morning, and good afternoon, Asian in ASEAN. Welcome back to the World Conference on Exercise Medicine. Today, we are coming back to the second session, which is Exercise and Immune System. I'd like to welcome for those who have registered and those who are in attendance. The World Conference on Exercise Medicine is an assembly of world-renowned speakers from the medical field and also the exercise scientists from various countries, as well as exercise leaders. Today, we are going to present to you 4 papers in theory and then 1 workshop. Right? So without any delay, I would like to introduce a very special friend of mine. I've known him for about 20 years ago. And he's a tall guy, which doesn't make me very nice when I stand next to him. Nevertheless, he's from Slovakia. Professor Dr. Dusan Hamar is a professor of sports medicine from the Faculty of PE from Slovakia. He is also an international scientific committee of exercise medicine. He was a shot putter, and his field of interest in the science is on how to work on strength. He's also the chairman of the scientific commission and also an elected member of the executive committee of the International Federation of Sports Medicine. Widely known in the American College of Sports Medicine, Dr. Hamar is also an international scholar for this prestigious association. So I would like to welcome Dr. Dusan Hamar as a chairman and also to present you the first paper on exercise and the immune system. Dr. Hamar, please. Thank you.
Thank you very much for the nice introduction. Before I start, I'd like to say a few words of appreciation to all the organizers of this conference, especially Dr. Jesse Lai for supporting generous support of this conference, and all the team around Professor Lee, namely Hani and Kalai, who are keeping this conference going on despite of this difficult situation. I know how difficult is it to organize all those people from around the world, and that's why I appreciate what they do. Today we will have a session of exercise and immune system. We have 4 speakers. I will start with a brief introduction, brief overview of immune system and the role exercise may play affecting its function. And then we will have Dr. Kalaivane Subramaniam, and the topic of the talk will be like cardiorespiratory fitness and immune system. And then next speaker, Dr. Mandy Zhang from Singapore, will discuss the role of intensity and dose of exercise on immune system function. And finally, we will have Dr. Zsombor Laczsa, and he will shed a light on mechanism how immune system of an athlete fights the SARS-2 coronary virus. And so that will conclude today's session. And then we will have a session of aerobic exercise. So that's the plan for today. And I try to share the screen with you. I hope it's okay now. Can somebody give me a feedback if it's okay, if you can see the screen? Hello? Hello, can you hear me, Kalai? Can I continue? I hear no response.
Hello, Dr. Dusan. I can hear you very well. You can start.
Okay, so I can continue. Okay, fine. So so this is the topic of my talk today. As I mentioned, I will provide a brief overview of immune system and the role of exercise in affecting its function. So I will start with a brief definition of immune system, or what the role of immune system in the human body is. It's basically to protect the body from potentially harmful agents, and those agents can be either external pathogens, namely germs as bacteria, viruses, or parasites, but also kind of foreign proteins. Body tries to reject any foreign proteins, what can be very, very protective function, but in case of transplantation, this is what causes the problems. I mean, the physicians has to cope with. And then also the role of human immune system is to get rid of abnormal cells within the human body. I mean, the cells can be damaged either by infection, by mechanical impacts, or by any other toxic substances. And once damaged, I mean, they cannot fulfill their functions. The body has to get rid of those cells. And the same applied for the mutated cancer cells. You know, nowadays the theory of cancer is that it's actually the failure of immune system to get rid of abnormal cells, which are being created in a human body in huge quantities every day. So those are the principal function of immune system. An immune system consists of two basic components. The first of all, of so-called innate immune system. This is the system which is non-specific. I mean, it can fight any intruder to the human body, and the response is rather fast. I mean, these systems or these mechanisms are readily available to protect the human body. And then we have a more sophisticated immune system, which is called adaptive, and this system is more specific. It takes more time to work for this system, but it's more focused on the particular pathogenic influence to the human body. And what is also very specific for this system, that there's a kind of memory that the immune system remembers the offender, and the next time this negative influence comes, this adaptive immune system can respond faster and more efficiently. Briefly, to innate immune system, these are, as I mentioned, non-specific mechanism which protects our body from external influences, and it includes the skin with all the saprophytic bacteria. You know, these are very important because, I mean, they occupy the space and they do not allow the pathogen bacteria to set in. So many times nowadays, the experts are mentioning that too much disinfection might not be the best idea, because you kill all those protective saprophytic bacteria and open the chance, you know, for pathogens to set in. Then we have specific substances, enzymes in the tears and in skin oils, mucosal membranes, which fight any intruder to human body via these ports of entries. And also the stomach acid has a has an effect, a protective effect against foreign pathogens. And then also physiological mechanisms like cough and sneezing reflexes are in a way the mechanism which help the body to fight the pathogen coming to the body. Then there are specific chemical components like interferon, interleukin-1, and others, which are also helping the body to protect against infection. And last but not least, we have a variety of immune cells with some functions, and we will discuss this a little bit later on. This adaptive immune system is, as I mentioned, is a system which detects the specific pathogens and recognize that, and then those cells recognizing these pathogens, they are multiplied, and once there's enough quantity of those cells, they start to produce the specific antibodies against these pathogens to fighting the infection. And then in the after phase, the other parts of the immune system will take care of those dead cells and will finish the immune reaction. And what's I already mentioned, what's very specific, those cells keeps kind of memory, and this process, which is at the first time, at the first encounter, a little bit slow, takes days. After second or after repeated exposure, this response is much faster and can take place within hours. So if I summarize the slide with basic characteristics or basic components of innate and adaptive system, you see the immune cells plays the role in both innate and also adaptive immune system. So those are the cells of immune system. You see the most common, well-known are neutrophil, but then we have also B lymphocyte, platelets, monocyte, T lymphocytes, mast cell, eosinophils, natural killer cells or T lymphocyte, basophils, and also dendritic cells, and last but not least, macrophages. Those are the cells of immune system with very specific functions. And as you see on this slide, most of those cells plays a role as a part of this innate immune system, and there are specific cells like B cells and T cells, which plays a role in this adaptive immune system. But we have some parts of cells, namely natural killer cells, which plays a role in both innate and adaptive nervous system. So these immune system cells, they are distributed in the body in various tissues. It's a bone marrow, and then lymph nodes, which are around in the body, mainly in abdominal area, but also in axillary, in inguinal area. Then it's the spleen. Then there are those immune cells in intestine and mesenchymal area in this form of Peyer's patches, and also appendix contains the immune cell, and last not least is the thymus, tonsils, and adenoid in nasal area. The immune response, both innate and also adaptive, they depend on many factors. Many factors can affect the response, as for instance, time of the day, genetics, and previous vaccination, amount of stress. Gut microbiome is very important. Nowadays we get more and more information on this. And also obesity, age, alcohol consumption, smoking, and then also, as I mentioned, and what is a partially topic of this talk, also the physical exercise and physical fitness affects the function of immune system. So the first reports about the effect of exercise on immune system comes from the early 20th century, but those were rather descriptive, and in particular, those were reports about changes of leukocyte counts in response to exercise. However, the most current knowledge comes from the recent 30 years. That's a period during which the exercise immunology developed a lot, and thanks to a lot of studies over those 30 years, we have now fairly solid knowledge on the effects on exercise to function of immune system. The knowledge comes from two kinds of studies in principle. Those are epidemiological studies, which focus on incidence and severity of disease in relation to intensity and volume of exercise. And also there are studies which focuses now on response of immune parameters, and we know more and more of them to exercise, again, in relation to its type, intensity, and volume. So what can be summarized from the studies so far is that those human epidemiological studies, they basically show decrease of incidence of infectious diseases in active subjects, and also in some risky groups like diabetic patients, the inclusion of physical activity program has been shown to decrease the mortality on influenza in this kind of risky patients group. And then there are animal models, mostly on mice, and there are many studies showing positive effects. For instance, there are studies showing the effect of aerobic exercise in terms of decreasing mortality on influenza or bacterial pneumonia in animal models. So, generally speaking, the exercise and immune system, I mean, the relationship is such one that there's a decrease of incidence, severity, and mortality of infectious diseases, and improvement of various immunological indices. So generally, it's considered as a positive effect in terms of fostering the immune function. However, those studies mostly involve the physical activity of moderate kind, and the question is, what is the threshold? I mean, what is a moderate and what is a severe physical activities? And most of the studies agreed that the threshold is, in terms of aerobic exercise, some kind of 60 minutes activity at about 60% of VO2 max daily. Why I'm mentioning a kind of threshold and why I'm mentioning the moderate and severe physical activities, It's because it has been shown that some 20, 30 years ago, on elite or the athletes who took part on strenuous or exercise with high volume, like marathon, that the incidence of reported upper respiratory infections in a week after following the race was much higher than in general population. So the reason for this has been, I mean, it has been speculated. It was related to decrease of cellular IGF-1, and also some changes, namely decrease of immune cell counts of natural killer cells, neutrophils, and macrophages. So those are components of innate immune system. So this suppression of immune system usually lasts between 3 to 72 hours, and this is called like the open window theory or elite athletes paradox. So these are the effects when the exercise is high in volume and intensity, but as long as it's kept below this threshold, then the effects of exercise is generally positive, as I mentioned, and the mechanism are the following. During exercise, there's increased mucose secretion. Some experts say that the exercise is best expectorants you can find. So this is one of the possible protective mechanism. Then also increase of temperature during the exercise is considered to be similar to fever reaction, and that also can help to fight infection. Then the immune cells are mobilized from the depots in the spleen and venous blood, so they can more, be brought to the places where they are needed. So there's enhanced ongoing exchange between circulation and tissues of the immunoglobulins, anti-inflammatory cytokines, neutrophils, natural killer cytotoxic cells, and immature B cells. And this recruitment of immune cell is more efficient in recognition and eradication of virus-infected cells. And also the reduced stress hormone release is considered to be positive mechanism which improves the immune function. So the relationship between the volume and intensity of exercise and the function of immune system is usually being displayed in a form of this J curve, which shows that no exercise it's not good for immune system. Moderate exercise is fine, but too much exercise in terms of intensity and volume may have some kind of detrimental effects on immune system. So this has been for many years generally accepted theory. However, nowadays there are some criticism of this open window theory, and this criticism is based on fact that the elite athletes may have this J curve shifted much to the right, because they can tolerate better high intensity and volume better than normal population. This is part of IOC Medical Commission consensus, and also some recent analyses show that the athletes, runners, marathon finishers, that they usually have higher sensitivity to reporting the disease of upper respiratory infections. So the results might be not totally, but to some extent influenced by this higher threshold for reporting of upper respiratory infection disease. there has been studies shown that this potentially negative effect of exercise high in volume intensity can be mitigated by ingestion of carbohydrate beverages, and this approach attenuates increase in plasma cytokines and stress hormones, and it's mostly ineffective against suppression of natural killer cells and T cell function and cellular IGF-1 output. So they have tested also a lot of other substances like glutamine, antioxidants, anti-inflammatory drugs like ibuprofen, but these results were negative and there were no protective effect recorded. The exercise has an effect on so-called immunosenescence, and that means that normally immune system deteriorates with aging, as most of other functions of human body, and it has been shown that appropriate exercise can have a very, very profound positive effect on immune system. In one of those studies on cyclists, it has been shown that 75 years old cyclists, they had lesser immune system deterioration than 20 years younger subjects, non-exercising subjects. And in terms of function and number of T cells, they were comparable to 20 years old sedentary subjects. So this is a very, very important aspect of exercise and its effect on immune system in relation to aging. Nowadays, we know that regular exercise also decreases the risk of cancer, and not only that, but there are nowadays studies showing that the treatment or the management of oncologic patients, including the exercise, namely focused strength training, can increase the chances for survival of this widespread disease. So this is also the field which is developing in recent years and drawing a lot of attention. And we also had a symposium on that last week. And there are also studies on animal models showing clearly that tumor-bearing mice randomized to voluntary wheel running showed significant reduction in tumor incidence and growth across the 5 different tumor models. So we don't know exactly, what the protection mechanism is, but taking into account the recent theory of cancer, of its reason, it's quite clear that the immune system plays important role in this protective mechanism in preventing and also better outcome in treatment management when the exercise is included. We know nowadays there are also potential that exercise can affect the vaccination response. So there are preliminary studies showing that the response to vaccination can be affected by exercise. So more studies are needed, but this is also a promising direction, how to use the exercise to foster the immune system. Of course, there are other factors which can, as I mentioned, the immune response is very complex, and together with exercise, also the appropriate nutrition can be an additive factors in fostering the immune system response. So the healthy nutrition means it should be rich in fresh vegetable, nut, fats. I mean, all what we know from modern nutrition. And contrary to that, it should be low in saturated fats and refined carbohydrates and sodium. So in this way, we can foster the immune system. And there are also, it's a big business, the supplementation, but there are some indices that some of them, not all of them, some of those supplements can enhance the exercise effect on immune system, namely omega-3 fatty acids, probiotics, vitamin D, melatonin, curcumin. So I may conclude this brief overview that we have enough evidence nowadays that regular and moderate exercise represent powerful tool for boosting of immune system, with the potential of decreasing risk and severity of infectious disease, and also decreasing risk of therapeutic outcome of oncologic disease, and increasing of efficiency of vaccination. Its effect may be enhanced by appropriate healthy nutrition and some nutritional supplements and reasonable lifestyle. That means enough sleep and restraining from smoking and alcohol. So thank you very much for your attention. I just did it in the time I have been supposed to, but I think we still have a time for a few questions if there are any. Okay, now I'm in my chat box. There's a question concerning the recent COVID pandemic. I didn't want to be too specific in my overview, but I think there will be the especially final presentation more focused on this issue. But generally, I can assume, and there's the opinion of all the experts around the world that the appropriate exercise is important preventive measure against the COVID-19 disease. And there's a similar question which focuses the same issue. So I think we will have the final presentation, which is more focused on this issue. So I think it's a time to move to next presentation. And as I mentioned already, the topic of the presentation is cardiorespiratory fitness and immune system. And the presenter is Dr. Kalaivane Subramaniam. So please, the line is yours.
I'm Dr. Kalaivane Subramaniam, a medical doctor from Malaysia. I have actually experienced working in exercise medicine when I was in Kuwait, where I was attached to a research institute which is called Dusan Diabetes Institute, and there I was attached to the Fitness and Rehabilitation Center, where we do cardiopulmonary exercise tests, and we do it before and after exercise intervention to see the progress of those clients who come and exercise there. So today I will be presenting on cardiorespiratory fitness and immune system. Okay. So let's start. So here I will be focusing on the basic components of immune system, which I briefly will be talking about immune system, and later the association of moderate aerobic exercise with immune system, and later on we'll be going through some clinical trials where we'll be talking about moderate intensity exercise intervention, how it influenced the cardiorespiratory fitness and how it improved the immune response. So, and finally I'll be summarizing on the immunoprotective effects observed in all these studies. Okay. So first I'll start with the immune system. The immune system actually consists of leukocytes responses to pathogens. They are divided into innate response and also adaptive response. Innate response is actually the first line defense, and it's not specific to any any pathogens, and the timeline is 0 to 96 hours. This is the immediate response that we see when the body system is exposed to any pathogens. This innate response is divided into physical barrier, phagocytes, and natural killer cells. The physical barrier includes the skin and the mucosal immunity. The mucosal immunity actually refers to the immune response by the mucosal membranes, which involves the gastrointestinal, urogenital, and respiratory tract. Meanwhile, phagocytes refers to macrophages, which produce cytokines as a stimulant of immune response, and neutrophils exits from the blood vessels when to the cells to act on the pathogens, while natural killer cells are the killer cells which kills the bacteria, virus, and also cancer cell. When the pathogens escape this innate response, that's when the adaptive response starts. That's why it says it follows the innate system. But the adaptive response is very specific to a pathogen, and it produces an antigen-specific memory, so that if the antigens attacks again, the body system actually recognizes them. Okay, they are divided into T lymphocytes and B lymphocytes, where the killer T cells actually acts on the infected cells, and the helper T cells actually produce cytokines to enhance the immune response. Meanwhile, the regulatory cells actually protects the normal body pathogens from being attacked by the immune cells, while B lymphocytes, they produce immunoglobulins to attack the antigens. Okay, the immunoglobulins are actually the antibodies, and these immune cells are not commonly found in the circulatory system. They are mainly confined to the lymphoid and also spleen. Go to the next slide. So here I would like to explain how moderate aerobic exercise actually influences the immune system. So an expert review in 2019 actually revealed the presence of circulating immune cells around the circulation for up to 3 hours after brisk walk. But these immune cells doesn't remain there after the 3 hours. They started fading off. For this, the exercise should be consistent. So, and further on, multiple intervention studies found that moderate aerobic exercise more than 5 days a week over 12 weeks had lowered the number of upper respiratory tract infection by more than 40%. With these two information, we could actually relate it by saying regular acute bouts of moderate aerobic exercise is actually needed to give a cumulative immune protective effect. So someone has actually have to exercise regularly and have the acute bouts of moderate aerobic exercise where the immune cells start circulating, and this has to be done at least for 5 days a week, 5 days or more a week, for as long as possible, to actually give the cumulative immune protective effect. However, in resistance training, although the immune cells are increased in the body, but it also actually is a response of the body's response to repair the damaged muscle tissue due to the resistance training. But there's not much research to back up this on its benefits on immunity. Okay. So before I go and relate cardiorespiratory fitness, which is my main topic in this presentation, I would like to briefly talk about cardiorespiratory fitness. Cardiorespiratory fitness is actually the ability of the circulatory and respiratory system to supply oxygen to the skeletal muscles during sustained physical activity. And the primary measure of this cardiorespiratory fitness is the VO2 max, which is also called the maximum oxygen uptake. Okay, so this VO2 max is actually the index that is the best index for aerobic capacity and also cardiopulmonary function. So as you can look at the graph on the right, you can see there are actually two lines. The yellow line refers to untrained person, and the orange line refers to the trained person. Okay, so the yellow line plateaus at 32 and the orange line plateaus at 59. So you can see the oxygen uptake is actually better on the trained person than the untrained person. And even studies have actually came out with by saying that VO2 max, improving VO2 max by 3.5 will actually lower the risk of premature death by 13%, which is actually very significant in this case. Okay, so and this VO2 max, if you can see the table on the left, it's different for men and women. So the range is different, and they are actually categorized to 6 categories, which is like superior, excellent, good, fair, poor, and very poor. I actually highlighted the good and fair. It's because most of us will actually go under that good and fair criteria, except for those who train regularly, they would be under superior or excellent. Okay, and those who never train at all, because the good and fair, they still do some activities, so there will be some values in the VO2 max. But then when those who don't do activity, who is a coach potato, and then never walk, never go for a walk, just sit there and watch TV, they might be under the poor or very poor category. Okay, so I would like to introduce about this VO2 max before I go further on the exercise intervention and its influence on VO2 max. Okay, so the association of cardiorespiratory fitness and immune system. So here, the moderate intensity aerobic exercise, which refers to 60 to 75% of maximum heart rate when you exercise, in frequency of 3 to 5 days per week, ranging from 20 to 60 minutes and 10 to 12 weeks. These are some clinical studies which has been done for a very long time, and they had shown significant improvement in cardiorespiratory fitness of the participants. So, and there are multiple scientific evidence which has demonstrated positive association between moderate intensity exercise intervention and the host immune system. So through these two statements, I can actually say cardiorespiratory fitness has also contributed in improving the host immune system. So when you look at the J curve on the right hand side, you could see with moderate exercise, the URTI risk falls by 40 to 50 URTI actually refers to upper respiratory tract infection, and with moderate exercise it falls 40 to 50%. And however, overtraining without adequate recovery have negative impact on immune system. As we can see, heavy exertion, there's 2 to 6 fold increase in upper respiratory tract infection. Okay, now for the next 2 slides, I'll be going through some randomized controlled trials. Well, I'll actually picked up a few of the trials to talk about it, so that we can actually summarize and conclude what are the immunoprotective effects given by through these trials. Okay, a few randomized controlled trials found that participants in aerobic exercise group, which is the moderate intensity exercise intervention 3 to 5 days, 30 to 40 minutes per session for some studies were 8 weeks, some studies were 12 weeks, some studies were up to 1 year. They have reported lesser episodes of acute respiratory illness compared to participants with sedentary lifestyles. Moreover, this illness which occurred in the exercise group, it was the severity and the days of illness showed at the lower trend. Okay, first I will have a look at one of the trial where a 12-week walking group. This was done only on elderly who are with the average age of 73.3, and they showed low URTI incidence with higher natural killer cells and T cells in their blood, and they have also showed 12.6% improvement in cardiorespiratory fitness from average of 19 to 21.4. Okay, so here we can still say moderate intensity of exercise improved the cardiorespiratory fitness together. So in another study, they actually looked at 1-year exercise intervention on postmenopausal, non-smoking, overweight and obese women with average age of 16 showed decreased risk of self-reported cold with significant increase in cardiorespiratory fitness. The third study is 12 to 15 weeks of training in adults aged 35 to 50 years old, showed reduction in acute respiratory infection, also in both severity and total day of illness. So we could see some of the infection that occurred in the exercise group, they actually didn't last long and it was not very severe. However, in this group, they didn't find any difference in the neutrophil counts. And all the studies, actually most of the studies showed 18 to 46% risk reduction in URTI incidence, as we could actually observe in the J curve just now. Okay. Okay, in this slide, I'll be going through some studies which actually focused on other responses, other immune responses. Okay, the first one is on a 16-week of 30 minutes moderate intense walking program among 32 postmenopausal women, corresponding to 75% of individual maximum heart rate, and they can increase the secretion of salivary immunoglobulin, that's the antibody in the saliva, which is the main immune defense in the saliva. And this program has also resulted in an increase in VO2 max by 10.4%. And the second study is which was done in 2009. It involves 44 sedentary healthy older adults with average age of 69.9, and they also underwent moderate intensity exercise for about 10 months, and this had reported that this moderate aerobic exercise improved antibody responses to the influenza vaccination, where the exercise group actually experienced influenza seroprotection throughout the influenza season. So this exercise group, they had vaccination before, and throughout the influenza season, they actually didn't have any symptoms of influenza. So this actually, it's good for those who have had vaccinated to exercise to improve the influenza seroprotection actually. And this group also showed significant improvement in VO2 max. Okay. The next study, this was a very recent study in 2020, where they look at astronauts during their 6 months mission into the International Space Station. Those with higher cardiorespiratory fitness, mainly more than 36.5, and higher skeletal muscle endurance, are 40% less likely to reactivate a latent herpes virus. It's like the virus includes varicella zoster, Epstein-Barr, and herpes simplex virus. This is like chicken pox, you know, they didn't have any reactivation, although they were like in 6 months there with so much stress. And these are the trials that I have gone through, but there's not many trials which actually looked at the cardiorespiratory fitness, as in like the VO2 max itself, and how it improves the fitness level. So that's why I had to actually relate it through the moderate intensity of exercise, which improves the cardiorespiratory fitness and how it responds to the immune system. Okay, so the conclusion, I've concluded that 10 to 13% improvement in cardiorespiratory fitness as a result of moderate aerobic exercise has reported to. So what I'm saying is that moderate aerobic exercise actually improved the cardiorespiratory fitness 10 to 13% in the studies that I have gone through, and they have reported to augment the host immune system. That means reduce incidence of upper respiratory tract infection, and also enhance response to vaccination. Like when they get the influenza vaccination, they were less likely to get any influenza infection, and there was reduced in the severity and duration of respiratory tract viral infection. This will actually reduce the transmission, so less likely they would infect others. And it also improves the immune function in elderly. As you could see, most of the studies are done on elderly, and as we know, elderly's immune function decreases with age, and if they have medical condition, it decreases further. So it's also important for them to have a moderate aerobic exercise to improve the immune function. In addition to that, we also found that VO2 max, which I actually look at the number in the last study that I mentioned, the superior and excellence level are the range that is reported to protect against reactivation of latent virus. So as a keynote here, through my presentation, I would say to mobilize the immune cells in the circulatory system, you actually need the sufficient stimulus. That means you need the proper dosage of exercise to stress the cardiorespiratory system, so that you actually see the results of the immune response. Okay, so we need to exercise by reaching at least 60 to 75% of our maximum heart rate, at least 3 days per week, and ranging from 20 to 60 minutes. Okay, so and in view of current pandemic state, I would say moderate aerobic exercise is the best route, and it should be used as an adjunct to preventive measures like wearing masks and washing hands. And the main point here is to maintain the activity in some regular, consistent pattern to build an illness clearing immune system. So that's the end of my slide, and thank you for listening. And if you have any questions, you can contact me at my email at kalaivane@yahoo.com. Thank you.
Providing more details about the effects of exercise on the immune system. And I like the slide in showing the importance of...
Thank you for listening to my talk. I have here. The first question is, after 3 hours, if the immune system dilutes, then how to boost it again? A person cannot do frequent exercise. Actually, for this question, I would say regular exercise is the only answer. Okay. Only with regular exercise, the immune system will stay longer and it does its work. So I think regular exercise is the answer for that. And second question will be, what is the threshold of exercise frequency to justify as overtraining in aspect of cardiorespiratory training? Actually, to check the dosage, first you have to categorize the person, whether they are inactive, they're moderately active, or they're active. Inactive in the sense they exercise only, they don't exercise at all or just exercise once a week. And moderately active, they exercise like 1 to 3 times a week. And active person will exercise usually like 3 to 5 days per week or even more than that. And in this condition, those inactive, healthy people, they could start at 50% of their maximum heart rate. And those moderate active, 55, and then those who are active can go to 60%. In case they have any underlying health condition, then the inactive people can start at 55. Then the moderately active people will go to 60, and the active people will go to 65. Okay. So that they don't overtrain, they just stick to this. And as I mentioned earlier, they should exercise at least 20 to 60 minutes. Okay, and the third question is by Dr. Sandeep Podar. And if exercise for going office means for work is not boost immune system, I heard, is it true? I don't really understand the question. I'm just assuming that he's asking whether like walking to office actually boosts immune system or not. As I mentioned earlier, you have to have the target, the proper dosage. It has to have the percentage of the maximum heart rate. In this case, I would say 55 to 65% of maximum heart rate is needed actually to have the proper dosage, to have the immune response too. The next question is, Doctor, what is your opinion on people who got vaccination and died? Okay, is this related to our immune system, the response to the vaccination? I don't think so. And the last question, when doing cardiorespiratory fitness, asthma patient may increase their symptom or shortness of breath. Actually, asthma patients depends on how severe the asthma is. If it's under control, it should be okay. If those who are not under control, and then maybe they should take their asthma medications before starting the exercise. The next question is on, is cycling exercise 4 times a week with moderate intensity can increase our immune system? Depends on the dosage, whether you get the target heart rate to the range that I mentioned just now. And do you actually exercise for the time, like 20 to 60 minutes that I've mentioned just now? Thank you. Okay.
Okay. Thank you very much for your presentation and also addressing the questions. And we can move on to the next presentation, which will deal with whether the exercise is helping or harming to our immune system. And the presenter will be Dr. Mandy Zhang from Singapore. So please, line is yours.
Hello, everyone. Thank you. And thank you for the kind introduction. It's my pleasure to be here today. And I would like to thank WCEM Conference for extending their invite to me. A very good afternoon to everyone. And my title today is, does exercise help or harm the immune system. The body's immune response reacts to exercise in many ways. There is an increase in stress hormones, typically cortisol hormone, and we also expect a change in cytokine concentration, as well as an increase in body temperature, blood flow, and dehydration. In response to exercise, the hypothalamus secretes CRH, or otherwise known as cortical releasing hormone. In turn, this hormone activates the anterior pituitary and stimulates the release of ACTH. ACTH then stimulates the adrenal cortex to release cortisol. Once released, the cortisol is taken up by the blood and transported to different tissues throughout the body: skeletal muscles, adipose tissue, and the liver. At these different tissues, cortisol mediates critical physiological processes which aids in exercise capacity and recovery. For example, cortisol promotes protein to be broken down into amino acids in the skeletal muscles and triglycerides in adipose tissue to be hydrolyzed into free fatty acid and glycerol. High circulating cortisol can also stimulate gluconeogenesis in the liver. In this particular study, the authors examined 30 minutes of exercise at 40%, 60%, and 80% of VO2 max in an attempt to provoke an increase in circulating cortisol. This figure depicts mean cortisol levels pre and post exercise. At baseline, there were no differences in the 4 experimental sessions, but at 60 and 80% intensity, a statistically significant increase in cortisol was observed. The findings support the concept that moderate to high intensity, 60 to 80% of VO2 max, provoke significant increase in circulating cortisol, while 40% of VO2 max results in reduction or no change in circulating cortisol. This is a busy slide, but it depicts the intricate immune mechanism of macrophages, natural killer cells, neutrophils, T cells, cytokines, and immunoglobulins following exercise, which I think the previous speakers have gone through as well. But let's look at some of these cellular immune parameters in the body when exercise is performed. So in this study, 8 triathletes underwent 30 minutes of high-intensity exercise. The figure shows a typical example of exercise-induced leukocyte subpopulation change, and data points of measurement were taken at rest, during exercise, last 2-minute exercise, 30 minutes, 2, 6, and 24 hours after an intensive exercise. We observed the rise of the number of neutrophils, lymphocytes, and monocytes during the first few minutes of exercise. With neutrophils, there is a second increase and peak at the 2 hours post-exercise before declining back to baseline at 24 hours. Lymphocytes and monocytes almost reach maximum values within the 30 minutes of exercise, and immediately after cessation of exercise, there is a rapid decline of lymphocytes. Monocytes fall below pre-exercise levels within 2 hours of cessation of exercise. And what are the implications? So cell counts like this may be quite similar during an URTI infection, as well as following acute bouts of exercise. And so we go back to this J-shaped hypothesis, which some of you may be familiar and fleshed out by the 2 previous speakers. This J-shaped curve describes the relationship between exercise intensity and the risk of acquiring upper respiratory tract infections, which is closely related to the immune system. This hypothesis suggests that moderate exercise has the ability to improve immune exercise above sedentary levels, while high-intensity exercise depresses the immune system. After prolonged or intensive exercise bouts, the components of immune system may reflect physiological stress and immunodepression. This period often lasts 3 to 72 hours and is commonly known as the open window for infection. However, intense exercise-induced immunodepression is multifactorial in origin. Although we see increased numbers of neutrophils with decreased number of lymphocytes, impaired phagocytosis and neutrophil function, decreased oxidative burst activity, decreased natural killer cell, and diminished immunoglobulin levels. None of these functions reflect the immune function as a whole. Therefore, measurements of blood leukocytes by number and function may not reflect the immunocompetence of the body as a whole. Now, let's look at some studies investigating the relationship between exercise and the immune function. In this study, 530 male and female runners were recruited, of an average age of 39 years old. Monthly log for 12 months on exercise dosage and illness was done. Illness definition for cold was as if they complained of runny nose, sore throat, or cough. And it was found that running mileage of 486 to 865 miles was associated with a high likelihood of having a URTI, odds ratio of 2, while running more than 866 miles was associated with an even higher likelihood of an URTI, odds ratio of 3.5. So in this study, they concluded that running dosage is a significant risk factor for URTI. In another study, comparing elite, recreational, and sedentary controls on the incidence of URTI, 32 elite, 31 recreational, and 20 sedentary controls aged 18 to 24 years old were recruited. A prospective surveillance study was carried out over 5 months of training and competition period during summer and autumn. These participants were instructed to report daily illness symptoms, and then they were confirmed on nasopharyngeal and throat swabs. These swabs were analyzed using microscopy, culture, and PCR testing for typical and atypical respiratory pathogens. It was found that URTI rates were higher among elite athletes than recreational athletes during training and competition season, a difference of 311 days versus 92 days. However, it was noted that there may be other causes of unidentified non-infection cause of URTI, as only 30% of pathogens were identified on these nasopharyngeal and throat swabs. Gleason et al. Carried out a research to evaluate the influence of training load on respiratory tract incidence and in antigen-stimulated cytokine production. 75 endurance athletes were recruited and divided into 3 groups depending on their exercise duration. 3 to 6 hours a week were considered low, more than 11 hours were considered high, and anything in between moderate. It was found that URTI rates were lowest in those who exercised 3 to 6 hours per week. And those who exercised more than 11 hours had approximately higher interleukin-2, 4, 10 than the ones who exercised 3 to 6 hours per week. Hence, it is postulated in this study that high levels of physical activity are associated with increased risk of URTI and may be related to an elevated inflammatory cytokine response to antigen challenge. This other study aim was to investigate the relationship between sport training and the risk of common illnesses in highly trained swimmers. So 28 French professional swimmers aged 16 to 30 years old were monitored weekly over 4 years. Their training was noted and the diagnosis was diagnosed by sports physician. The results showed that illness of common illness was higher in winter months, and the odds of URTI illness increased with every 10% increase in resistance training and high load training. The odds of illness was 50 to 70% higher during intensive training periods. And it was also noted that national swimmers had higher risk of international swimmers despite similar training schedules. This is interesting, but this could be due to better resistance or lower pro-inflammatory responses to infection in international swimmers, which make them renowned and good in their sport. How about more recent? 4 years ago, in the 2016 Summer Olympic Games, 132 athletes from 11 sports were invited to participate in this survey. Questions on probiotics, travel, psychology, sleep, and nutrition were asked. It was found that the prevalence of URTI was 46% prior to the major game, and low energy availability was associated with almost fourfold increase of sustaining an illness. It was noted that most illness lasted 2 to 7 days, and as a follow-up, illness prevention program should include the evaluation of nutrition, mental health, sleep, and building resilience to form part of the athlete's training program. This other study was done to provide epidemiological information on injury and illness to develop effective injury prevention strategies during the FINA World Championship. 5,923 elite aquatic athletes from 6 disciplines were included. And this was a retrospective survey given to athletes 4 weeks prior to the start of the championships, and medical staff reported illness and injuries prospectively during the games. Focusing on illness, the incidence ranged from 7 to 13%, and 1/3 of the complaints were respiratory in nature. Interestingly, the injury incidence was higher for high diving, water polo, and diving, whereas the illness incidence was highest for water polo and swimming. This difference could be due to variations in training and competition exposure, as well as in-competition contact with other players, which could increase the risk of illness and infection. This study was done to analyze the frequency and characteristics of sports injuries and illness during the World Athletics Championships. The illness rates was 68.2 per 1,000 athletes, and 30% complained of URTI. This study supports and suggests that elite and highly trained athletes experience high incidence of common cold and URTI. In the same vein, at the Beijing 2015 International Association of Athletics Federation World Championships, out of 307 athletes, 13% reported an illness syndrome, and endurance athletes were seemingly more likely to sustain an in-championship illness than speed or power athletes. But exercise is not all that bad, right? We consistently hear that exercise is the key to good health. It promotes good mental health, strong bones, regulate the immune system, and that is true. A group of 91 obese women, BMI 33, with an average age of 45 years old, were randomized into 4 groups. 12 weeks of moderate intensity, walking at 60 to 75% of maximum heart rate, and or moderate energy restriction. The effect on innate and adaptive immunity was also examined. As a result, they did not find that exercise training had any impact on the resting immune system. However, they noted that the days of URTI reported was lower in those who performed moderate intensity exercise than the controls, a difference of 5.6 days versus 9.4 days. Another study was designed to evaluate the potential preventive effects of meditation or exercise on incidence, duration, and severity of acute respiratory illness. 154 community adults were recruited and randomized into 8 weeks of meditation, moderate intensity exercise, and control groups. The exercise group had to have 2.5 hours of group session per week and perform home exercise 45 minutes per day at moderate intensity measured by RPE, or rate of perceived exertion, 12 to 16. When examined for the mean days of absenteeism due to respiratory illness, there were 48% fewer days missed in exercise group and 76% fewer days missed in the meditation group as compared to the control group. It was also found that the exercise group had 14% reduction in illness incidence, 23% reduction days of illness, and 31% reduction in global severity when compared to controls. Similar findings are observed in the Asian population. In a cross-sectional study done in China, 1,413 employees reported their episodes of URTI, frequency of leisure time exercise, and smoking status through self-administered questionnaires. Focusing on leisure time exercise categories, participants were grouped into 3 different groups depending on their frequency of leisure time exercise. Low, defined as less than 4 days per month, medium, 1 to 2 days per week, and high, more than 3 days per week. The striped bar represents no episodes of cold, the grey 1 episode, the dark grey 1 episode, the grey 2 episodes, and white 3 episodes. Unfortunately, the intensity of exercise was not recorded. However, it was found that the incidence of URTI was highest for those who exercised less than 4 days per month. And 84.8% of low exercise frequency group reported at least 1 episode of common cold, whereas exercising of more than 3 days per week was associated with 26% reduced risk of having at least 1 episode of common cold when compared to the low frequency group. In another study done by Neiman et al., 1,000 adults were followed up for 12 years during winter and fall seasons. They were asked to self-report their physical active levels or physical fitness levels, as well as their daily illness symptoms. These physical fitness levels were rated by the participant using a 10-point Likert scale. And it seemed that URTI was more prevalent in the winter than fall. When we look at the total days of URTI, the total days of URTI was 46% lower in those who rated themselves as very or highly physically active than having a low physical fitness. And the total days of URTI was 43% lower in those who exercise more than 5 days per week than less than 1 day per week. In another Swedish population-based prospective cohort study studying the disease status and lifestyle factors, this study reported 18% reduction of URTI in those who exercised more than 55 mets per hour per day as compared to low level of activity levels measured less than 45 mets per hour per day. So we go to this question. We know that exercise is important and helps modulate our immune system. But from previous research, too much exercise may actually harm the body and the immune system. Doing too much too soon can be harmful, but doing too little leaves us with poor immune system as well as suboptimal performance. And so, how do we find the exercise sweet spot to combat inflammation? It's all about managing training load. But beyond just managing training load, it is also important to understand the influence of the following factors: their age, their physical qualities, their previous sporting experience, previous medical history, stress levels, sleep, and diet. We talked about the J-shaped curve earlier on, but I would also like to introduce the S-shaped curve in elite athletes. The S-shaped curve is adopted in very elite athletes where they are better adapted to the demands of their training and their infection odds ratio decreases even at high intensity. The definition of elite can be different in different sports, but for example, marathon race times of less than 3 hours or training distances of more than 100 kilometers per week has been used in some studies. This hypothesis states that low and high exercise loads increases infection odd ratio, where moderate and very high exercise loads decreases infection odds ratio. But this needs to be verified by compiling data from a larger number of subjects. So to conclude, I'll leave with some summary slides. The J-curve model correlates URTI risk and exercise workload continuum for recreational and our community athletes. Moderate intensity exercise of less than 60 minutes per day may enhance immune function above sedentary levels. High exercise training load and competition are linked to transient immune dysfunction, leading to increased illness risk. But the S-curve model is adopted in very elite athletes where they are better adapted to the demands of their training. We see that chronic exercise has its benefits. It enhances recirculation of immunoglobulins, anti-inflammatory cytokines and neutrophils, which lead to enhanced immunity and defense system. I'd also like to emphasize that besides load management, we also need to look at psychological, lifestyle strategies such as sleep, vaccination, nutrition, hygiene to reduce the illness incidence during competitions. With that, I thank you and I hand the time back over to the moderator.
Okay, thank you very much for your presentation, and now you can take some questions. We have a time for Q&A, so switch to the chat box and
Okay, hi. So I've got a question over here. The question is, so if competition or stress is present during exercise, it causes injury to our immune system. So thank you for the question. Well, we do see that when the body is under stress, the immune system may be affected for a transient period of time, but then it do normalize to baseline after recovery. So the thing about, I think, building on the immune system. So and the chronic exercise is important to help build up the immune system. So if you were to do, if you're doing a unaccustomed exercise, high intensity, that you're not used to it, the immune system would dip for a little while, but we do expect it to increase. However, if the immune system is consistently triggered in this similar manner, in a controlled manner, then ultimately we do see the J-curve shifting slightly to the right, and the athlete is able to manage the sport better without having too much impact on their immune system. Okay, are there any other questions? Okay, so I have a question. How about high intensity interval training effect to the immune system? Yeah, so a transient dip in the immune system. We see that when it is an unaccustomed bout, high intensity, there may be a dip in the immune system for a transient period of time, but it should return back to normal. So we do see a more stabilized effect, a maintenance to the immune system with moderate intensity exercise. But when it's prolonged and high intensity, the immune system supposedly seems to drop a little but then it does return back to baseline. Okay, I have another question from Kevin. Would like to inquire if the immune system studies were only for healthy subjects, or those with comorbids could also have improvements following the J curve. Yes, so I would say most of these studies that were done were mainly on healthy subjects. However, we do see in the J curve with moderate intensity exercise that seemed to be a sweet spot for the majority community adults and recreational athletes. So when we talk about comorbids, these patients may have other special considerations to take note. So for example, if you are diabetic, then we'll need to also take care of make sure that they go slow, start slow. Their other hypocounts are taken into account. But when they are reasonably fit, we can progress them from low intensity to to moderate intensity and keep them there. Okay, I have a question here. How do we measure low, moderate, and high intensity exercise? Is it by maximum heart rate or? Okay, so I think the question is, how do we measure low, moderate, high intensity exercise? Well, there are different ways we can measure them. If we are talking mainly towards the recreational or community adults, I think the talk test is a good indicator. So when I say the talk test, it means if you can talk but cannot sing, then that's moderate intensity. If you can talk and you can sing, that's probably low intensity. And if you cannot talk and you cannot sing, that's high intensity. So while engaging in the exercise, you can use the talk test as a gauge, and moderate intensity would be if you can talk but cannot sing. The other ways of measuring intensity would be using your max heart rate. So a maximum heart rate would be 220 minus your age. So that would give you a number. So if you are 50 years old, your maximum heart rate is 170 beats per minute. From 170 beats, you can then make a percentage. So for moderate intensity exercise, you will try to hit about 64 to 76% of your max heart rate. So if you do a quick calculation, 64% of 170 beats would give you your moderate intensity exercise. Anything below would be lower intensity. Anything higher would be considered high intensity. And the last way or most common way of measuring would be using your rate of perceived exertion. So it can be on a scale of 1 to 10 or 6 to 20. So if we use the scale of 1 to 10, anything about 4 would be moderate intensity. And then if you go up the scale, the box scale, that would be higher intensity. Anything lower than that would be low intensity. Okay, so I have another question. During my talk, when I mentioned about moderate exercise, does it refer to intensity or to how vigorous the exercise is? So I think when I mentioned about moderate exercise, that would be moderate intensity. When we prescribe exercise, we go through the FITT or the FIT principle: frequency, intensity, time, and type. So frequency will be how many times a week you are engaged in the exercise. Intensity is usually related as whether it's low, moderate, or high. The time then would be quite subjective. How you prescribe exercise. I mean, according to the ACSM or the WHO guidelines, we look towards 150 minutes of moderate intensity exercise per week. And then the last T would be type of exercise. So when we use the FITT principle, we'll be able to prescribe a good amount of exercise, ensuring that the patients or the clients are having adequate exercise, not insufficient or not overworking themselves.
Okay.
Okay.
I think it's time to move to the next presentation.
Yeah. Okay,
Thanks
I do have a few more questions, but feel free to email me. I will be able to answer them on email. Thank you.
Okay, thank you very much. And now we can move on to the final presenter of this session. And as I mentioned, he will be shedding light on the mechanism, how the athlete's body is fighting with this SARS-2 coronavirus. So I may ask Dr. Zsombor Laczsa to present a paper entitled Sportsmen Infected with SARS-CoV recover by secretory and cellular immune response and do not develop long-term immunity through neutralizing IgG antibodies. So please, line is yours.
My name is Zsombor Laczsa. I am from the University of Physical Education, Budapest, Hungary. The title of my talk is Sportsmen infected with SARS-2-CoV recover by secretory and cellular immune responses and do not develop long-term immunity through neutralizing IgG antibodies. This is a complex title, but what shall I talk about? First, what is convalescent plasma therapy? And how is this plasma therapy applied as a treatment against COVID? Then how do athletes recover from the disease? How do they come into the picture of plasma therapy? And then, what are the key points before going back to sport? What is convalescent plasma therapy? Number 1. Somewhere somebody recovers from the disease. This means that they are typically about 4 to 6 weeks after developing the first symptoms. Number 2. In the convalescent phase, they apply for plasma donation. It is important to stress that this application is completely voluntary and unpaid. Number 3. We have to do a pre-screening, which means that we need to test whether their plasma is capable of neutralizing the virus through high IgG levels. It can be done directly with measuring the virus neutralization capacity in a biosafety lab where you can work with live viruses, or you can simply measure the IgG levels with an ELISA test. Number 4. In those who have a high enough IgG, we do a plasma donation. It is done in a certified plasma center, and typically we take about 600 milliliters of plasma from each donation. Number 5. This plasma is then treated and the donor is post-screened for typical transmissible diseases like HIV or like syphilis. We also measure the cytokine levels and we measure the IgG levels again in these plasma samples. These are then ready for therapy and can be stored up to 3 months at minus 25 degrees. Number 7. This plasma is used in a recipient who is blood type matched at the bedside. Typically, we use 1 bag or 1 to 2 units of plasma per patient, per treatment. And number 8, since this is not a standard therapy, it is going under a clinical study protocol and we have to do the monitoring of these patients. What are the results so far? Convalescent plasma is a complex process and this is highly manual. So we needed to set up the donor to recipient chain, and typically 1 donor is needed for treating 1 patient. So far we have about 600 donor applications. Out of them we were able to do 81 plasma donation. That tells you that roughly 1 to 10 is the ratio between the actual plasma donations and those who volunteered for it, which means that you need to have very high communication activity to get all those volunteer donations in order to harvest enough plasma. We have completed a pilot study on 23 patients and the survival rate was 16 out of these 23. This was somewhat better than the historic control of the same hospitals and same group, and this is on par with the international published results. We haven't seen any plasma transfusion related complications, so the treatment is going on, and right now we have about 80 patients treated. You can also see that from the 81 donations there are 80 patients treated, which means that there is no storage of this plasma. Basically each one which is taken in a couple of days time, it is applied in a patient. So there is very high demand for such plasma. So how do athletes come into the picture? So pro athletes applied for plasma donation in the first wave of the epidemic. In Hungary, we had 5 national teams who applied en masse because they were tested positive for plasma. And since they developed very little symptoms and they wanted to help, we were happy to receive their donations. This was the swimmers who participated in tournaments and training camps in smaller groups around the world, all of them in February and March. And after their return home in middle of March, they were tested positive. 19% exactly were tested positive with PCR against COVID. In fencing, there was a World Championship in Budapest, and 1 out of the 30 team members of the Hungarian fencing team were tested positive. The wrestlers, they're probably undermeasured. They had a World Championship in Rome in the middle of March this year in Italy, in Rome, and 8% of them were tested positive. The bikers, it was a small team of just 2 people who participated in an Olympic qualification competition in Turkey, and 1 of them got positive results. And the kayakers participated in an international training camp, and 2 out of 20 were tested positive. If to sum up this all together, it means that 11% of those pro athletes who were participating in international tournaments or international competitions in February or March tested positive. This is a very high number. Just compare it to the general population who were well below 1%, which is compared to this 11%. So these pro athletes, simply due to their lifestyle, because they travel a lot and they got in close contact with each other, they do get infected with COVID at least 10 times higher than the general population. We tested the cytokine storm markers in these athletes. Why did we do that? I mean, we all know that the biological response to COVID is to develop a cytokine storm, and those who develop it will typically have severe symptoms and go into a severe phase of the disease. So as you can see on these pictures, the black bars represent patients who are hospitalized and who are undergoing an acute COVID infection. The IL-6 and IL-8, the 2 interleukins which are well known for cytokine storm, are quite high in them, but these were quite low in those non-athletes or athletes who are already over this infection phase. And this was true for other cytokine storm markers like MIP1-alpha, GM-CSF or IP10. Interestingly enough, RANTES or CCL5, which is a marker for cellular immunity, was elevated in both those patients who are undergoing the disease in an acute phase and also the non-athletes who are already through the infection, but it was much lower in the athletes. So this warranted further investigations. In this case, we only measured the athletes and grouped them into 2. Those with high RANTES was one subgroup, and those with low RANTES was another subgroup. And as you can see in the boxed figure, of course, those who were selected in the high group had a high RANTES level around 600 picogram per milliliters, and the others were low, meaning very low, close to the measurement limit of the test. Interestingly enough, IL-1 beta and its antagonist IL-1RA were also elevated in the high RANTES subgroup. And this was also true for TNF-alpha, IL-13 and MCP-1. This means that these 6 cytokines seem to move together and then they are all elevated in a subpopulation of athletes who have undergone a COVID infection, but they have already recovered from this infection. Please note that these cytokines are different from the cytokine storm cytokines, which means that these patients, although they have a high inflammatory status, this inflammation is not related to cytokine storm, and it's not directly related to the virus, since these patients are already all negative with PCR, so they don't have the virus in their body anymore. So let's compare all the results and then put them into one figure. In this table, each line is one athlete and each column is one symptom or one measurement. As you can see in the first column, symptoms were positive in some, roughly half of the athletes, but quite a lot of them did not develop any symptoms whatsoever. The PCR tests are roughly the same, although I have to note that these are probably undermeasured. Now, interestingly, the third column, IgA, the secretory immunoglobulin, is quite high in roughly 1/3 of the athletes, which means that these athletes probably developed a mucosal immunity and they fought the disease locally without developing systemic responses. Now, since we are quite late, like 4, 6 or 8 weeks after the first symptoms, IgM is already negative, if it was ever positive, but interestingly enough, IgG was also negative. Only 1 out of 29 athletes developed a strong IgG response. So our first call for plasma donations for convalescent plasma therapy was basically not working with these athletes simply because they did not have enough high enough IgG levels, just 1 out of 29. Now, on the other hand, RANTES, which is a cellular immunity marker, it was high in about half of the patients, meaning that these athletes, although they recovered from the disease, they still showed a high immunological status or highly activated immunological status. And one would hypothesize that these different variables, all related to COVID to some extent, would group together. So one would say that, for example, those who have strong symptoms, they are PCR positive and they are positive for IgG and RANTES. Now, this is clearly not the case, as you can see it from the table, but also in the figure, is that no matter how we group these different variables, there is no single factor which is emerging that is driving the others, so it really needs further investigation. So let me show you 2 examples. One was Kapás Boglárka, who is an Olympic gold medalist swimmer, basically the star of our swimming team, who participated at a competition in Thailand in March 2020. She tested positive on return, but she had basically no symptoms and the repeated PCR tests were negative. Now, nonetheless, she applied for plasma donation, but we didn't find any IgG in her blood, so we didn't take the plasma. She returned to pro sports activities very soon afterwards. Now, the other example is Tóth Bendegúz, who is a World Championship medalist wrestler, a very strong guy who was completely healthy and who participated at a competition in Rome in Italy in March 2020. He was also tested positive on return. He also had very minimal symptoms, but the repeated PCR tests were still positive, and also the RANTES was elevated in his blood. Interestingly enough, no IgG levels were measured in his plasma, so basically he didn't develop an IgG-based immunity against the disease. He also returned to pro sports activities soon afterwards and died of a sudden cardiac arrest a couple of weeks later. So that tells us that although some athletes are very strong and they have close to 0 symptoms for COVID, and you only know that they have caught the disease because they were tested with PCR routinely, still there is a possibility that they develop this lingering highly activated immunological status, which in our case is measured with the high RANTES level, and then they are more susceptible to sudden cardiac arrest than the others. So this is a strong warning sign. So what are the next steps? As you have seen, convalescent plasma therapy is a first response measure which is available soon after a new epidemic develops, but this is suboptimal. It is a very manual process. There is a short storage time, blood type matching is required, and there are highly variable IgG levels in the blood. So therefore, a mixed polyclonal superimmune IgG combination that can overcome these drawbacks would be much more preferred. And that's what we are working on now. So what is the take-home message? First, professional athletes are highly susceptible for catching COVID, and it doesn't change with the first or the second wave of the disease. They have a lifestyle, which means that they get in close contact with each other, they travel a lot, and there is a high chance that they will actually catch a disease like COVID. However, they have relatively mild symptoms and seldom develop IgG-based immunity. Most probably the IgA response or the cellular immunity are responsible for overcoming the disease in this subpopulation of patients. However, you have to be warned that sustained inflammatory status is observed, and that may increase the incidence of cardiac complications. So I would like to thank my team, who is seen here in the picture in these COVID fighting uniforms, in which we sometimes feel like Ghostbusters, that they were working day and night in order to complete this investigation, and also for getting this anti-COVID plasma therapy for the patients. Thank you.
Thank you very much for the great talk, great insight into the mechanism of the immune system response to the COVID in athletes, and so now we have a time for the Q&As.
Okay, so the first question is, what is your advice to improve immune system to decrease the risk of infection of COVID? So basically, coronavirus is just yet another respiratory disease. So you should do the same thing than what you would do in order to not to catch flu, the common flu. So basically, moderate exercise, preferably outside, where you have exposure to all kinds of environments, and that will strengthen your immune system, your respiratory immune system. As you have seen in our data, about 1/3 of the patients fought against COVID with only IgA, meaning that it is very important to have your mucosal immune system workable or working. Okay, next one. What do you think of current SOP to run exercise center gym? Since this pandemic will live with us for quite some time, do you have recommendation to improve the service of gymnasium exercise center to cope with the pandemic? Honestly, I think we should suggest outdoor exercises and not gyms, because gyms have, small rooms which are concentrated. Quite a lot of people are exhaling into the same air, even if there is strong air conditioning, like in Malaysia most of the time. Still, this air is circulating there, and then people are basically just close to each other. And on top of that, there are the shared facilities. So proper recovery and moderate exercise helps fight COVID. Yes, definitely. What we have also seen, and now we have a webinar to share it with coaches, is that after returning to exercise, or after catching COVID and recovering from it, and then when you return to exercise, especially in top athletes, you really have to do a cardiac evaluation, and then get your cardiologist a green light before you go into strenuous exercise.
Okay, I think that everybody had the chance to ask the question. If it's not the case anymore, I'd like to conclude this session by thanking to all the speakers, and to the participants, I'd like to announce that you should stay connected because we have a planned workshop on aerobic by Adasandha is from Malaysia. And now the question is to the organizers whether we make a break for a few minutes and start sharp at the planned time, or we can continue right now. Hani or Kalai, what's your proposal, or Professor Lee? Do we make a break and start sharp at
Hello, I'm Adasandha and I'm an exercise leader from Kuala Lumpur, Malaysia. Today we're gonna do workshop of aerobics. Okay, but we're gonna start with chair exercise first. Chair aerobic exercise. Benefit from chair exercise is one of them is reduce from fall, because chair-based exercise improve posture and balance. It also can increase our blood circulation, improve self-esteem, and body coordination. Are you ready? Okay, please grab a chair. Make sure it's safe and stable. Alright? Now, I want you all to sit up straight like this. Okay, do not slouching. Okay, chest up, stand tall. Alright, sit tall, sorry. Okay, and then smile. Alright, are you ready? Okay, let's follow. Now, march. Keep marching. Yep. Keep march. So now, first step, we're gonna do heel touch like this. Half tempo. Good. Alright, half tempo. This is heel touch. Good. You will feel at your gastroc muscle and soleus, of course. Now try follow the beat. Fast beat, go. Speed up. Good. Nice. Okay, good. Still heel touch. Good. Yeah. Last 4. Now we add chest press here with your hands. Good. Again. Go. Okay, now step touch here. Step, touch, step, touch. Good. Nice. Very good. Still. Sit up straight. Good. Chest tall and smile. Now, with the hands, go. Now, roll your arm. Good. To your right and left. Nice one. Okay, we're gonna combine the first step and the second one. Okay, start back with heel touch. Go. And chest press. Good. Nice one. Very good. Are you with me? Yeah. Woohoo! Good. And then remember next, what's next? Step touch. Good. Roll your arm. Good. Easy, right? So you can do by yourself at home or maybe at your office, and you can teach your client or patient. Okay? Keep moving. Yes. What's next? We're gonna do flick kick. Leg first, okay? Now, kick, down. Left leg, good. Right leg, now. Alright. Keep moving. This is half tempo, okay? Good. Are you ready? Follow the beat. Now, speed up, go. Yes, very good. Right and left with the beat. Nice one. So, hands, you can do like this. Up. Good. Just slash with both hands. Keep moving. Go. Nice. If you sit up straight, you will feel exercise at your core muscle and your back muscle. Good. Now from top, heel touch. Go and chest press. Nice one. Good. Keep moving. And smile. Ready for step touch. and roll your arm. Go. Right and left. Good. Nice. Again. Next one. Ready for flick kick. And go. Ha. Yep. Nice one. Very good. If you can do higher, try it like this. Ha. Ha. Good. Alright. Good. Keep moving. Nice. After this, we're gonna do double step. Yeah. Leg first. Go. 1 and 2. Yes. Good. Cut. Again. 1 and 2. Double step touch. Okay. Hands go. Nice one. Very good. Cut. Still, try bracing your core. Okay. Back straight so that you can work your core muscle. Are you okay? Still follow? Okay, all together from the top. Ready for heel touch. Go and chest press. Good. Nice one. What's next? Step touch. Yes. And roll your arm. Good. Ha. Last 4. Ready for flick kick. Go. Ha. Ha. Higher. Whoo. Whoo. Okay. It's okay. You can do higher or just normal. It's just make sure it's safe. Double step. Go. Ha. To the left. Good. Again. Still sit up straight. Now, jack. Open your leg and close. Ha. And close. You can pull the chair for stability. Good. I want you to do 2-time jumping jack. Follow the beat. Go. 1 and 2. March here. With the hands. 1 and 2 and march here. Good. Go. 1 and 2 and march here. Good. Again. Good. Again. Go. March here. 2 jacks. Go. 1 and 2. So for those who have lower back muscle, who have pain and knee injuries, you can do this kind of jumping jack. Go. It's safe. Alright. You just basically use your core muscle. Of course, because the body is moving, but not so tough. Okay, step, tap, tap here. Okay, this is just hold better. Hold. Okay, relax. We're gonna repeat from the top, all together from the top. Ready for heel touch and chest press. Go. Ha. Nice. Still smiling. Good. Still following. Good. Again. Last 4. Ready for step touch and roll your arm. Go. Yes. What's next? Ready for flick kick. Ready. Go flick kick. Ha. Good. What's next? Double step touch. Ready? 4, 3, 2. Okay. Go. 1 and 2. Your left. To your right. Yes. Keep moving. Yes. Ready for 2 jumping jack and march. Go. March here. Go. March. Again. One more. Tap. Good. Single tap. I want to change it to triple tap. Are you ready? Okay, good. 4, 3, 2, Right leg first. 1, 2, 3. March here. Keep marching. Left leg, 3 tap. 1, 2, 3. March here. Very good. Again. Right leg. And then try to continue with your left leg. Okay, good. 1, 2, 3. Good. 1, 2, 3. 1, 2, 3. Nice. 1, 2, 3. Good. 1, 2, 3. Pump, pump, pump. 1, 2, 3. Good. One more. All together from the top. Heel touch. Go. Chest press. Nice one. Good. Yeah. Whew. Are you okay? What's next? 4, 3. Step touch. Go. Ha. Yeah. Whew. Okay, what's next? Ready for flick kick? And 4, 3, 2, flick kick. Go. Okay. Nice one. Keep moving. Ready for double step. And go. Ha. To your right. Good. Left. Yes. Again. Last 2. Now ready for jump jack. 2 jump jack here. 1 and 2. Up. Add on some bit. So I add a little bit of roll up and down. Okay, good. Now triple tap here. 1, 2, 3. 1, 2, 3. Good. 1, 2, 3. One more. 1, 2, 3. Okay, how are you doing? Are you okay? I think that's enough for today for the chair exercise. Okay, you doing good? Still breathing? Alright, now inhale through your nose, exhale through your nose. Very good. Again, exhale, again, exhale. Okay, now we're gonna do aerobic exercise. Okay, follow me. March first. Again, stand tall, chest up, and smile. Try to follow me. Let's do it. Step touch here. Step touch. Step and touch. Good. Keep moving. We add the hand movements. Okay, roll your arm. Very good. Now try to follow me. Up and down. Good. Again. Now ready for double step touch here. 1 and 2. Good. Yes. And with the hands like this. Very good. Keep moving. From the top, go. Step touch. Good. Again. 2 more. Double step touch here. Very good. What's next? Try walk forward, 4, and then stay there. 1, 2, 3, 4. Here. Back. Walk back. Good. Walk forward, 4. Back. We add some hand movement here. Go. Very good. Back. 1, 2, 3, 4. Very good. Okay, from the top here, step touch. Yes. Are you okay? Double step touch here. Good. You also can do grapevine also can do. Walk forward 4. Go. 1, 2, 3, 4. Go. Now give me pony here. Like this. Okay, much here. Are you okay? You gonna repeat again, all together from the top. Ready? 4, 3, 2, step, touch. Again. Okay, double step touch. Or you can do grapevine, also can. Walk forward 4 from here. Hands up. Good, back. Again. And back. Ready for pony here. Go. Now from here, mambo. Give me 4 mambo. Right leg goes to your left side. Chin side. Good. Again, good. 1, 2. This is mambo in aerobics, okay? Good. Again, go. Inside. Now, here. Very good. And curl. You can do bicep curl here. Okay, back to mambo. Go. 4. 2 more. Chin side. Okay, here. Now. Nice one. Oh, you can do this. Oh, sunshine. Good. Woo. Again. Back to mambo. Ha. The other side. Very good. Heel touch here. And curl. Sunshine. Good. Are you okay? 2 more. Now sashay from here. Sashay, march here. Good. Sashay, march here. Sashay, march here. Again. Sashay, march here. Plus 1 mambo. Go. Sashay, mambo. And march here. Good. Sashay, mambo. March here. Good. Sashay, mambo. Very good. Again. Sashay, mambo. Okay, try to combine. Go. Sashay, mambo, and go. Sashay, mambo from here. March here. Good. Again. Continuously. Sashay, mambo. Sashay, mambo. March here. Good. Again. Go. Sashay, mambo. Sashay, mambo from here. Front, back, back. Still marching. It's just to step a bit far from your stand here. Front, and back. Sashay, mambo. Sashay, mambo. Front, back, back. Front, back, back. Keep marching. Can we change to jumping jack? For the front, back, back. Sashay. sachet, mambo, sachet, mambo. Ha, good. Run, back, back. Are you okay? Just 2 jumping jack. Okay, ready? And go. Sachet, mambo, sachet, mambo. 2 jack. Good. Very good. Much. Again. 4, 3, 2, go. Sachet, mambo, sachet, 2 jumping jack. Okay, step touch here. Are you okay? Back to 4 mambo. No, 4. 2 more. Change. Ready for heel touch? Now, go. Okay, curl and sunshine. Good. Nice one. 2 more. 1 more. Ready for sachet and single mambo. Sachet, mambo. Sachet, mambo. 2 jumping jack. Front, back, back. Step touch. Are you okay? One more time. 4 mambo. Go. 2 more. Yep. Chin side. Ha. Last 2. Heel touch here. Go. Bicep curl. Sunshine. Good. 2 more. Last one. Ready? Sachet and single mambo. Go. 2 jumping jack. Good. Front, back. Step touch. Good. Again. Now sachet jack. 2 jack. Good. Very good. Step touch. Are you okay? Like this. Like this. Good. Only single mambo. But then bend your body a little bit. Give me 8 more. Good. Last 4. Nice. Now, step touch. What's next? Maybe diamond, maybe not. Okay, try to follow. Right leg. Cross your left leg. Half tempo. And cross. Walk back. March here. Again. Ready? 4, 3, 2, right leg. Cross and cross. Back, back, back. March. Try to follow the beat. Okay. Start with your right leg. Ready. Go. Cross, cross. Back, back. March. Again. Cross, cross. Back, back. March. Same thing. Left leg. Cross, cross. Back, back. March. Go. Cross, cross. Back, back. Good. Right leg first. Go. Cross, cross. One more. Right leg. Cross, cross. Now, good. Don't forget to smile. Again, cross, diamond. Left leg. Good. Back. Again. Open your leg wider. Left. Right. Like you are driving. No, you cannot drive like this. It's so dangerous. Step touch. Good. Good. Are you okay? So you're gonna start with the single mambo with the arm movement like this, okay? And bend your body to the front a bit. So now, very good. Keep moving. 4 more. Last 2. Okay, diamond. 1. Back. 1 more. Good. Open your leg wider. Nice. 4 more. Good. Left leg, go. Cross, cross. 2 step back. Cross, cross. Good. Open your leg wider, go. Hup. Nice one. Again, go. Hup. Good, good. Two. Diamond, go. Good. One more. Open your leg wider. Good. Left leg, go. Cross, cross, back. Again. Cross, cross, back. Open your leg wider. Nice one. Step touch here. Whew. Are you okay? Is it enough for the warm-up? Okay, let's do the dynamic stretching a bit. Only a bit, alright? Go. Up. Full stretch. Ready for side reach here. Hup. Very good. Now try to facing your left side. Good. Your leg. Alright. Now swing your arm like this. And of course, your back heels up. Again, go. Now, both hands up, down, do it. Again. Tap your front leg, go, like this. Good, chest press here. And you will feel the stretch at your tibia. Like tibia, yeah, like this. Tap your front leg. Okay, ready? To the other side. Swing your left arm. Good. Back heels up so that you can stretch at your gastroansolis muscle. Good. Now both hands up. Bend your body a little bit. Good. Give me 4 more. Now tap your front leg like this. And arm. Disco. Tap. Boom. Or you can just do chest press just now. Like this. Also can. Okay. Keep moving. Yes. Back. Foot tricep. Push shoulder. Back. Bicep. And tricep. Okay, keep marching. You wanna repeat from the top? Are you okay? Or you wanna add some more? Step touch here. Ready? And go. Good. Up. Give me 2 more. Double step. You can do double step touch or you can do grapevine. Whatever you want. Okay, march. Are you okay? Next, give me 4 mambo. Not yet, sorry. Step touch again. Good. Hup. Again. Last 2. Double. Good. Double or grapevine. This is double step touch. And this is grapevine. Okay? Step forward 4. 1, 2, 3, 4. Back. Thank you. Now pony here. Go. Step touch here. Good. Are you okay? Ready for Mambo. Go. 3 more. Chin side. Again. Go. Change. Ready for heel touch. Go. Sunshine. Again. Now 4. Chin side. Go. Heel touch. Sunshine. Good. Sunshine. Good. One more. Step touch here. Good. Are you ready for next? Sachet and single bamboo. Ready? Now, sachet bamboo. Sachet bamboo. 2 jumping jack. Front, front, back, back. March it. Are you okay? Good. Again. And go. Sachet bamboo. Sachet bamboo. 3 jumping jack. Again. Sachet bamboo. Sachet bamboo. Sachet bamboo. 2 jumping jack. Now here. Very good. Give me 4 more. Ready for diamond? Right leg, cross leg. Cross, cross, step back. 1 more. Cross, cross. Good. A little wider. 2 more. Left leg, go. Cross, cross, step back. Good. Cross, cross, open your leg wider. Like this, go. Go. Shake your shoulder. 4 more. Very good. Now, diamond, cross, step back. 1 more. Cross, cross. Open your leg wider. 4. Ready for left leg? Go. Same thing. Cross, cross, step back. Cross, cross. Open your leg wider. Can we repeat all together and combine? Step touch first. Are you okay? Are you with me? How was it? Can you feel your heartbeat increase a little bit? It's good for your blood circulation. Make you look blush and pretty. Okay, are you ready? All together from the top. We try to combine all together. Are you okay? Step touch. Ready? Roll your arm. Go. Okay. Again. Again. One more. roll your arm. Double to your right. Walk forward 4. Hands up. 1, 2, 3, 4. Good. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, pony. Are you okay? All together from the top. Go. Down. Up. Double step. Go. Very good. Walk forward 4. Go. 1, 2, 3, 4. 1. Yep. Now, pony here, I cut. Good. Okay, ready for 4-man bowl? Go. Ha. Nice. Chin side. Good. Heel touch here. Good. Heel. Good. Sunshine. Nice one. Give me 2 more. Nice one. Down here. Four more. 2. Good. Good. Back. Again. Open your leg wider. Now. Nice one. Very good. Left leg. Back. Good. And back. Good. Ready for sachet? And single member. Go. Sachet, member. Sachet, member. 2 jumping jack. Again. Sachet, sachet. 2 jumping jack. Step touch here. Good. Can we try it for one last time? Okay, all together from the top. Alright. Ready? 4, 3, 2, go. Ha! Roll your arm. Go. Up. Double to your right. Walk forward 4. 1, 2, 3, 4. Good. Pony here. What's next? 4-man bowl. Right leg to your left side. Go. Good. Chin side. Heel touch here. Go. Hand sunshine. Good. 2 more. 1 more. Ready? Sachet first. Sachet, single member. Jumping jack. Good. Step. Good. Sachet, member. 2 jack. Good. Now, ha. Four more. Now, leg. Good. 1 more. Open your leg wider. Go. Left leg. Last one. Okay, go. Step touch here. How do you feel? Yes, we are finished already. I hope you can enjoy this simple step, basic step in aerobics that you can do at your home, at your office, or you can teach your patient or your client, Alright, so aerobics exercise is very good for your heart, for your blood circulation, for your body coordination, alright? It will make you look good if you do it regularly, right? Maybe you can do 3 or 4 times a week. Alright, I think that's all for today with me. Thank you for having me in this webinar, and thank you for joining my aerobic workshop. Thank you, everyone. Can you hear me? Hello? Can you hear me? Okay, good. All right, so I will check the question. Hold on. So how is it? Okay, start from now. No. Okay, from Dr. M. Rambabu. Very nice. We can do only on chair or any other equipment. Yes, we can do with steps aerobic, steps, step board, you know, the step board, the one that we step on it. Or we can do with bicycle sometimes, but you just turn on your music within 20 minutes, 60 minutes, and then just move and shake, make sure it's safe. All right. And then what else? Fit ball, the big ball, or some call it Swiss ball or fit ball. All right. That one is also safety first. All right. Make sure not slippery, or maybe you can put exercise mat and then sit on the ball on the exercise mat. Okay. All right. Wait, I have a low back pain. Can I follow your program? Yes, I do have a patient with lower back pain also. Normally, I do aqua aerobics in the pool, swimming pool, and chair aerobic just now, like the first one that I do. But make sure you consult with your medical doctor first. Okay. And make sure you let your trainer, exercise therapist, know about it. All right. Don't keep it as a secret. Okay. Yes. Aerobic we can do within 20 to 60 minutes. Actually, we can do for 2 hours also. We can because it's aerobic. It's just a low intensity training. Not really high intensity like HIIT, Tabata, or whatever. So we can do it, and after we finish our session, we still can perform our daily tasks. All right. Okay. Is that all? Am I answering all the questions? Adli? Okay. Thank you. Bye.
Okay, I'm Dr. Kalaivane. Taking over from Dr. Dusan Hamar. So I hope everyone who joined had a great workout session just now. And thank you everyone for joining our session. And hope you guys gain from our presentation and the workout. And don't forget to join us tomorrow, 3 p.m. on our topics on exercise and mental health. Okay, thank you.